We are live. We are live. Welcome to Medical Monday, where I am Dr. Frita, and I give you the updates on celebrity health and all of the health headlines in the media. Okay, we talk about everything here. We have a great show for you today. We'll open up with my favorite little game, Myth versus Fact. And our Myth versus Fact is going to be about blood clots because primetime Deion Sanders, who's been going through quite a lot as far as his health and the headlines, shares that he has more blood clots. Yes, this is a recurrence of blood clots. And so we'll talk about risk factors, how to recognize blood clots, and what to do. Then we'll get into our weekly dose, where I'll give you a fresh take on the headlines you simply can't get anywhere else. We'll talk about breast cancer in men. Yes, we'll talk about how Mr. Matthew Knowles had an interview with Carlos King, the king of reality, talking about his experience with breast cancer as a man. And we'll go over more risk factors of breast cancer, including some genetic markers. And then we'll talk about cruising. How many of y'all are planning on going on some cruises, like over Thanksgiving, maybe over Christmas? Well, beware, because there have been many instances of infections on cruises, specifically ones that cause people to vomit and have diarrhea. And it's back. We'll talk about the most common cause of foodborne infection and how already we're at our 19th outbreak of this virus on cruise ships. Be careful. I'll tell you how. And then we'll talk about RFK Jr. Y'all know when I come here, I tend to tussle with the head of Health and Human Services, RFK Jr., because he is unqualified. And that's just not my opinion. Now we have six, count them, 1, 2, 3, 4, 5, 6 of the former surgeons general of the United States. They have come together and written an op-ed saying how RFK Jr. is a threat to our nation's health. This is a huge deal. And so we'll talk about that op-ed, and I'll ask you what you think. And then we'll talk about Dolly Parton. You know, a couple of weeks ago, we talked about how she shared that she had to cancel a concert and she had a kidney stone. And then her sister, Frita, yes, her sister, Frita, went and did an announcement, and everybody thought that Dolly Parton was almost out of here. Well, now Dolly Parton has come back and she said, I'm not unalive yet. And so I'll give you some updates on Dolly Parton. And then, guess what? I'm also going to give you a major health update on the man in the White House. Yes, Donald J. Trump.
Hey, Dr. Frita.
Hello, hello. Welcome, welcome. Can you hear me well? Can you see me well?
We can hear you. We can see you.
All right. Let's get this thing going, Shador. Let's go. Welcome to Medical Monday. Well, Shador, how was your weekend?
Weekend was good. Went to my nephew's soccer game. Pleasant weather.
Oh, yeah, the weather was good.
I know it was gorgeous. So yeah, had a good time at a little game. They won.
Very good.
Relaxed. How was your weekend?
It was good. It was actually pretty. It was great, actually. Of course, you know, we always have basketball. My son had some basketball games. We had some fun, took them to some parties here and there. But we had the kidney walk, Shador, the National Kidney Foundation Atlanta Kidney Walk. And you know, we had a good time. I got a chance to do something. I have an exciting announcement. I'll have to wait some months. It's a big deal, secret announcement. But it's some good news. And I'm sharing some very important health information. And it's going to air on a nationwide, international really show. And it's just another way to get awareness out. And of course, I am a board member of the Atlanta National Kidney Foundation, where we promote kidney disease awareness. I met so many people I've seen over the years, Shador, who've had transplants, people who've been donors, people who are walking in honor of family members who had kidney disease. And we just had a really good time. As always, you know, they had the DJ Tron was on the 1s and 2s. We had Maria, the same person we had last year, who is a radio personality, and she was leading all of the line walks. Yes, we did with them fans out, everything just a warm up for the walk. It was a really, really, really good time. My youngest daughter, Avery, was there. Okay. She didn't have a basketball game, so this year it was her turn to volunteer. And then my sister, Miss Jetty, came out as well. So it was a good time. Got to see a lot of people. So yeah, it was a great weekend.
Excellent.
So I don't know if Deion Sanders had a great weekend. He's always very positive, prime time. You know, last time we were here talking about him, we were sharing that he had bladder cancer, and he had some type of a new technology as far as having a bladder that was made of his intestines. And we know prior to that, he had a history of blood clots. Well, now he has recurrent blood clots. The blood clots have come back. And so he seems to be very open with his different medical issues. So let's play this clip, and then let's play my favorite little game, myth versus fact, when it comes to blood clots. But first, who was the first one in the chat, Shador?
Absolutely. First in the chat today was Purple Onion.
Hi, Purple Onion. Welcome back. Welcome back. I hope you're ready. You know I'm about to ask you some questions, Purple Onion.
And our member is here, Miss Andrea. Says good afternoon, Dr. Frita, Miss Shador, and chat.
Good afternoon. It's always good to see you and have your participation. I appreciate you for being a member, Miss Andrea. All right, let's play this clip and let's get into our little game.
All righty.
I got more blood clots. Cat's out the bag, all right? I think I got more blood clots, man. It don't make sense. I'm hurting like crazy. I'm not getting blood to my leg. That's why my leg is throbbing.
CU Buffs football coach Deion Sanders is undergoing surgery today. Now, he was telling fans there after the game Saturday he's hurting, and he suspected he may have more blood clots in his legs. So, big day, and I'm glad you're with us for Denver 7 News at 5 today. I'm Shannon Ogden.
And I'm Jessica Porter. Coach Prime has made a lasting impact on the Buffs and the entire Boulder community in just 3 seasons. Denver 7's Colin Riley went to campus to listen to students' well wishes and learn more about his procedure.
I'm outside Folsom Field on the CU Boulder campus, and we came up here today because we heard Coach Prime was giving an update on his health, and that he did, although with not much detail. He did say that he is going into a procedure today, but he expects it to be pretty routine.
I'm having a procedure today. Prayerfully, I'll be right back tomorrow because I don't miss practice. I don't plan on doing such, but it is what it is.
The procedure is called an aspiration thrombectomy, a minimally invasive surgery that will remove blood clots from Coach Prime's legs. The surgery is expected to take about 4 hours. He also said his work, his time spent at the field, have had no impact on his condition.
It has nothing to do with me working in the level that I'm trying to compete at. It's hereditary. It is what it is. It's nothing that I could have done to stop.
That's very good. He's giving some hints. Maybe he'll come out with more detail when he says that it's hereditary and there's nothing he can do to stop. And that lets us know that he might already know what his risk factor for having blood clots might be. But let's start off with our game. All right, everybody here on YouTube, everybody on IG, on Facebook, all of y'all in the replay crew, go ahead after you give us a like and let's get ready for myth versus fact, statement number 1 when it comes to blood clots.
All righty. Uncontrolled high blood pressure can raise your risk of getting blood clots.
What's blood pressure got to do with it? Put an M1 if that's a myth, an F1 if that's a fact. Uncontrolled high blood pressure can increase your risk for getting blood clots. M1 if it's a myth, F1 if it's a fact. All right, statement number 2.
Pumping your calf or leg muscles and moving your legs frequently during long road trips or airplane rides can decrease your risk of getting blood clots.
All right. Is it true? Does pumping your legs, pumping your muscles, does that really decrease your risk for getting blood clots? Or is that a myth? Put an M2 if it's just a myth. Put an F2 if it's a fact. Pencils down, pencils down. All right. Shador, do we have any takers?
Absolutely. All right, we'll go back to statement 1. Uncontrolled high blood pressure can raise your risk of getting blood clots.
This is an interesting one.
All right, so we have Donamichi says a fact. Hi, Donamichi.
Hello, Nurse Donamichi. Welcome. So you think it's a fact?
Anton says myth.
Oh, hi, Anton. Okay, you think I'm trying to trick you this morning. Welcome back, Anton.
Elonia says it is a fact.
All right, Elonia. Welcome.
Purple Onion agrees.
Purple Onion
Fact.
says what? That's a fact. Okay.
Lisa says myth.
All right. Welcome, Lisa. You think it's a myth. High blood pressure has nothing to do with it.
Yeah, and a couple from IG over here.
Hey, welcome,
TK.
IG. Hi, TK.
TK Shante says a myth.
A myth. Okay, you don't think that blood pressure and the clots really have anything to do with each other?
Oh, change it to fact. They changed to a fact.
You change it to a fact.
Change to a fact. TT.
Now, y'all know I'm a
Niku.
blood pressure doctor. Am I just trying to trick y'all? Woo-hoo-hoo, you never
I think
know.
so.
Okay, what now?
TT Niku says a fact.
Says it's a fact. Okay.
And Bread says a myth.
A myth. Oh, so we did have a mixed bag. Oh, that means this is a good one. I love it when we have mixed answers, not just because I like to be tricky Nikki, but also because that means that there's a place for learning. And so welcome everybody who's here from IG. Listen, IG, I did some things for y'all over the weekend as far as some posts. Oh, for any of you who've been, look, even if you don't watch Real Housewives of Potomac, you probably have seen where Dr. Wendy Osefo and attorney Eddie Osefo, husband and wife, have been arrested for some fraud charges. And a lot of people were saying that they looked high on the mugshot. And so, you know me, I'm always going to take the headline and find a teaching point. And so on IG, I did post the science behind looking high, physiologically what happens in your body to your central nervous system, to neurotransmitters, to blood pressure, to blood vessels. And I break down the science behind it. So check that out on IG. I have that for you. And then, I posted something else last night. So go on to IG, y'all. Thank y'all for watching. Of course, on Facebook, I appreciate y'all. We are over 904,000 subscribers. We are now marching towards 1 million. And so if you haven't subscribed, please do and hit the notification bell so you'll be among the first to know when we release new content. We're very proud over here to release evidence-based content in a way that's easy to understand, that will help you to advocate for your health and for the health of your loved ones. All right. So myth versus fact. High blood pressure. If you have uncontrolled high blood pressure, that increases your risk for blood clots. That is a fact. It is a fact. So here's what happens with your blood vessels. When you have uncontrolled high blood vessel, when you have uncontrolled high blood pressure, it does affect the inside of your blood vessels. So normally your blood vessels, your arteries, your veins should be nice and elastic. And the inside lining of your blood vessels should be smooth like butter, smooth like a baby's baton. But if you have uncontrolled high blood pressure, very high blood pressure, that actually damages the walls of your blood vessel. It damages the internal walls of your blood vessels. So once these blood vessel walls are damaged, that makes it easier for things like plaques, cholesterol, platelets, and other debris to stick on to the inside of the walls. And so if you have all these different things sticking to the inside wall, what will that do? It increases your risk for having a blood clot. Okay. So having uncontrolled high blood pressure damages the inside of your blood vessels, and that does put you at an increased risk for having blood clots. So yes, that's a fact. Yeah. Okay. That was a good one. Okay. All right. Let's see if we get them with myth versus fact statement number 2, Shador.
All right. Pumping your calf or leg muscles and moving your legs frequently during long road trips or airplane rides can decrease your risk of getting blood clot. The jury is out. Francis,
all right, jury.
Says fact. Hello, Miss Francis.
Okay.
Tracy says fact.
All right.
Tina agrees that it is a fact.
All right. Hey, Tina.
Our member, Ms. Rosalind, says it is a fact.
All right. Thank you for being a member, Ms. Rosalind.
CJ also agrees, Dr. Frita, fact.
So they think it's a fact. Did anyone think it was a myth? All right. So I did not trip y'all up on this one. Yes, it is a fact. And thank you to all of my members. Thank you to Ms. Rosalind, Ms. Andrew for participating. I also did something for y'all over the weekend. I did post a members only video. I have a members only video. So make sure you check that out. And for anyone else who wants to become a member, click the link in the description or visit me on drfrita.com, my one-stop shop. And remember, go ahead and give us a like, por favor. So let's talk some more about blood clots and pumping the legs. So what does pumping the legs have to do with blood clots? I'll tell you. So when you're dealing with veins, okay, and oftentimes when we talk about blood clots, we're talking about deep venous thrombosis. So we're dealing with veins. Veins have valves inside of them, and they largely rely on your muscles, the contraction of your muscles, in order to move blood smoothly back towards the heart. Well, if you're on a long plane ride, a road trip, If you have a sedentary job, like being a truck driver where you might be going straight for 8 hours without stopping, if your legs are just stagnant, if they're still, the blood will tend to pool, right? It'll tend to kind of collect and not really pump the way it should, unless you make sure that you're contracting those muscles. And so it is recommended that if you're on a long road trip, long plane ride, if you're just sitting still, then at least every hour, point and flex your feet and try to contract those muscles in your calves. Get up and walk around if you can every hour. Lift your knees. Make sure you do some type of a movement that will allow your calf muscles, your leg muscles to contract and to keep that blood flowing. And that will help to decrease your risks for blood clots. Okay. And so now I want to talk a little bit about the risks for blood clots. And I'm going to ask you all, what do you think some risks for blood clots are? What do you think some risks for blood clots are? And so make sure you put Clot, C-L-O-T, in capital letters so we know who's answering this question. Put Clot there. And as you put your answers up, let's just talk about what blood clots are. We already covered it some with one of our questions. You know, when you have some type of a damage, usually to the internal walls of the vessels, you can increase your risk by getting cholesterol, plaques, red blood cells to stick together. Fibrin, okay, can stick there. All these things can stick together and create a clot. But even if you don't have damaged blood vessels, even if you don't have high blood pressure, sometimes you might have a genetic predisposition to getting blood clots. In other words, you can have perfectly normal blood vessels and still you have a hypercoagulable state. You have blood that tends to clot more easily, okay? You might have an inherited thrombophilia. You may have inherited a reason to have increased clotting, okay? We know that about 900,000 people in the United States get blood clots every year, and literally 100 to 300,000 people lose their lives related to blood clots, okay? Oftentimes due to an embolism, when a blood clot breaks off and it goes to a dangerous place, like to the heart, to the lungs, causing a pulmonary embolism, okay, or PEs. You can also get blood clots in your heart arteries, causing a heart attack or myocardial infarction. You can get blood clots in your brain arteries, causing a stroke. So you can get blood clot related reasons for not being alive. So it's quite serious. So let's go over some of the causes of blood clots while we're talking.
All right. Donna Michi chimed in.
Hi, Donna Michi.
With sedentary lifestyle.
Nurse Donna Michi, you already know it. If you're sedentary and you're sitting around, what happens? Blood will pool in your vessels and you'll be at increased risk for having blood clots. And so we know that the American Heart Association recommends that most adults move their bodies for at least 150 minutes per week of moderate exercise. So that's about 30 minutes, 5 times a week. Just move your body. Okay. So yes, sedentary lifestyle is a risk.
Lisa J.
Hi, Lisa J.
Says knee surgery. She had knee surgery before and actually had a blood clot.
Come on to the front of the class. Absolutely. Knee surgery and orthopedic surgery in general. So be it knee surgery, knee replacement, hip surgery, hip replacement, fractured hip, anything that's going to cause you to be immobile, that will definitely increase your risk for a blood clot. And wait, and she said you had a blood clot yourself?
Had knee surgery and experienced a blood clot.
Oh, I'm sorry that happened to you. And I pray that you're doing well. But do you know this, Lisa J? Blood clots are the most common preventable hospital complication. Okay, so that's why if anyone has been to the hospital and people come to you and they offer you heparin injections or Lovenox, that blood thinner, is to prevent blood clots. And if even after an operation, you're feeling like, I don't feel like getting up, I just had surgery, and the nurses and physical therapy, like, oh, we got to get up, we got to walk at least to the restroom, it's because they're trying to prevent you from having blood clots. So I'm sorry that happened to you. You bring up an excellent risk factor, orthopedic surgery, like your knee surgery. Good.
On IG, TK says poor diet.
Hi, TK. So poor diet can lead to it in the sense that if you are a person living with obesity, if you are living with obesity, and if your obesity is due to a poor diet, that will put you at an increased risk for blood clots. Good.
All right. Francis says alcohol, surgeries, and drugs can lead to blood clots.
Definitely surgeries. And if you're taking alcohol, so alcohol in and of itself solitarily is not necessarily increased risk, but we know that alcohol is a central nervous system depressant, and central nervous system depressant. It is a CNS depressant. So if alcohol makes you sedentary, if you're doing drugs like downers or drugs that make you not move and you become sedentary, especially, Lord forbid, if you pass out for days, anything that makes you sedentary will put you at increased risk for blood clots. Good.
All right. Ms. Rosalind says, low blood flow. I had this experience and had back surgery. So developed blood clots from that as well.
Oh, I'm sorry that happened. But yeah, if you have low blood flow, specifically if you have low blood pressure, if you're not getting a good proper force of your heart and it's not pumping your blood so it's flowing smoothly, then that's going to cause a pooling or a sloshing of blood, and that could increase your risk. I'm sorry that happened to you.
IG
right now, medheads, y'all just need to come to the front of the class. I have not done an official survey, but I think I really do have the most brilliant chat. I'm not even kidding. Y'all are hitting on everything.
Yeah.
All right. All right. So that's sum up most of our participation.
I know IG.
Oh, there's more. Hey, G, how you doing?
So this is from Guess Who. Blood disorders can cause.
Let's talk about it. Okay, blood disorders. Let's talk about it. Let's talk about it. Okay, and you come onto the front of the class over there in IG. And listen, for those of you who have followed me different places, I do give different information. I do different posts on different platforms. So make sure you follow me at Dr.Frita on all social media platforms. On Wednesdays, I'm even on TikTok now on Wednesday mornings, 8:30 a.m. Eastern Standard Time, doing medical mornings. Those are quite colorful. So that's kind of fun. And then when I'm announcing when I'm going to be on different media, television, national news shows, then I'll tend to put that on IG and Facebook. And I'll go ahead and tell y'all now, I am going to be on Washington, D.C., the local Fox 5 on tomorrow, Tuesday, 3:15 p.m. Eastern Standard Time, I believe. But if you're following me, you'll get the notification. And so I'll be talking about some more good medical information. All right, let's talk about inherited disorders. So yes, you can have genetic predispositions to getting blood clots, such as inherited thrombophilias. So there's something called factor V Leiden deficiency that could put you at increased risk. Things like protein C and protein S deficiency. You can have an antithrombin 3 deficiency. I'm naming these kind of detailed words, but the point is, if you're someone who's getting blood clots, make sure you consult with your doctor and ask about a hematology consult. Okay, that's a blood specialist, hematology oncologist specialist, and they can find out if you're predisposed to having blood clots, because it may be recommended that you're on special medications, special blood thinners, okay? Because even if you're doing all the right things, exercising, maintaining a healthy weight, maintaining your blood pressure, if it's inherited, then it might not be anything necessarily in your direct control. It might just be an inherited predisposition. And other risk factors, y'all really covered most of them. But a lot of people with lupus, for example, will have something called antiphospholipid syndrome. And that's an autoimmune reason to have an increased risk for blood clots. And so if any of you know people with lupus who've had blood clots, or if you're a person with lupus, you've had blood clots, you might have antiphospholipid syndrome. And so it's something to check out. And so when Deion Sanders, primetime, is saying it's nothing he's done wrong, he's just predisposed to it, I imagine he might have some type of inherited thrombophilia, some type of a risk. And I'm sure that with all of his access to healthcare, he's having his family members checked out, and doing whatever it is he needs to do. The other thing is, if he already knew that he had an inherited predisposition, because he had blood clots before, I don't know this specifically, but a lot of times if you've had a blood clot, but then you've had major surgery like he had, then you get pulled off of the blood thinner so you don't bleed out in the surgery. Well, once you're pulled off of the blood thinners, that still puts you at risk for blood clots. And so it's kind of buzzard's luck, because you're at risk for blood clots, plus you're at risk from bleeding from where you had the surgery. So I really pray that he does well. And I love how he has been transparent and how he really does keep a positive attitude. And he never seems to feel sorry for himself. So all right, primetime. All right, Deion Sanders. And thank y'all for your participation. I'm proud of y'all. I'm proud of my little community here. All right. So y'all, please give us a like as we move on to our next topic. But breaking news. I do want to mention this before we get into our weekly dose. Donald J. Trump, your president, in the White House. Now, you know that I come on here and I tussle with everybody when it comes to health, and they're talking about stopping vaccines, like Governor DeSantis in Florida and that Surgeon General Latipo saying they're, talking about banning school mandates for vaccines. I tussle with RFK Jr. when he gives misinformation about vaccines and their link to autism. Not true, not proven. When he talks about all of these, different things, these untruths. Well, guess what? I always say you should watch what people do instead of just listening to what they say. So let's look at all the people with the most access, the privileged people, the billionaires, the people in government with access to the highest education. Look at what they do, not necessarily what they say. Well, President Trump released another visit. He called it a routine annual visit, although if you'll recall, he just had an annual visit in April. So why are you having another routine visit in October? Anyway, we'll deal with that. But he released in that report, they stated that Donald J. Trump got his flu vaccine and he got his COVID vaccine. Okay. So I'm not saying you do and follow things just because the president does them, but I do want you to consider, who do you think has the most access to the best health information? Like for real, not what's being said, for show or for politics, but just think about it, consult with your doctor. And I'll tell you, I say a lot, but I'll tell you what I do. I got my flu vaccine. I'm getting my COVID vaccine. My parents have both had their flu vaccines, COVID vaccines, shingles vaccines, up to date on pneumonia. Ooh, is it HIPAA when it's your parents, Shador? My point is, watch what people do and watch what people have their family members, their loved ones to do. Look at people who have lived it, who are scientists, who are studying it. Listen to what they say and what they do. Okay, so I just thought that was real interesting that we now know that despite what's being said by RFK Jr., head of Health and Human Services, about vaccines, despite the fact that they are cutting back on research of messenger RNA vaccines, which is what COVID-19, despite all of that, he went and he got his vaccines. Trump did, like he does every year. So pay attention and make the best decision for yourself. Okay. Don't be fooled by the hype. All right. Let's get into the weekly dose, where I give you a fresh take on the headlines you simply can't get anywhere else. Let's start off talking about Matthew Knowles. We know that October is Breast Cancer Awareness Month. This is supposed to be pink. It's kind of fuchsia. I don't know. We're still celebrating Breast Cancer Awareness Month. And Matthew Knowles, as I've mentioned before, I had a chance to be on a health panel with him where he shared, he's been very open about the fact that he was diagnosed with breast cancer back in 2019. Well, now he's still talking about it, thankfully. He had a conversation with Carlos King, Reality with the King. So let's play a clip of that and let's talk a little bit more about breast cancer in males and in everybody.
Diagnosis. A lot of people don't know this. You were diagnosed with breast cancer.
Male breast cancer.
Male breast cancer. And I don't think people even understand that that's a real thing. Like, did you know that prior to your diagnosis? I mean, obviously you sold, equipment that dealt with cancerous situations, but were you aware that male breast cancer was even a thing?
Well, I sold specifically mammography equipment. Yeah. And so the answer is yes. We did training in the 80s when we were the #1 modality. We did training on male breast cancer. 22,000 men a year worldwide are diagnosed with male breast cancer. But the more important thing is, through that experience, and I got a genetic test, there's something called BRCA2 mutated. Half of the world, almost, experts say, are mutated. That's why we have so much disease. The people are walking around with mutations with their genes from their parents and grandparents. Mine is called BRCA2, and for men, that means a higher risk for prostate cancer. My grandfather died of prostate. 3 of my dad's brothers died of prostate. His only living brother, 93, had prostate cancer, overcame it. Breast cancer is, I've done research. My grandmother on my mother's side, sister died of breast cancer. My mother's only sister died of breast cancer. 2 of her 3 daughters died of breast cancer. So
if you're carrying extra.
Yeah, I do love how vocal he is about breast cancer. And he brings up a point, Mr. Matthew Knowles, when he talks about looking at the family tree, because a lot of us are in families, depending on your culture, and your family will be like, don't talk about my business. What happens in this house stays in this house. And there's a place for that advice. But when it comes to health, our secrets make us sick because it's very important. And so it sounds like he's actually gone through his family tree, and you see it's quite rich, unfortunately, with breast cancer and prostate cancer. And as he was mentioning, when you have some of these genetic markers like the BRCA2 or PAL-B, there's different genetic markers that put you at risk, not just for one type of cancer, but they can put you at an increased risk for breast cancer, for prostate cancer, for pancreatic cancer. And so make sure you consult with your doctor and do a family tree where you look at first-degree relatives. And when I say first-degree relatives, I'm talking about people who are separated from you by 1 degree. So your parents, your mother, your father, your siblings, your children, those are your first-degree relatives. Second degree, we're talking about grandparents. Okay, we start to kind of move around, grandkids. So do a family tree of at least 3 degrees and kind of have, maybe you could do it at Thanksgiving or just hop on the phone or have a Zoom call and ask questions. And so you actually know what runs in your family. And we'll talk a little bit more about breast cancer. But first, I want to ask this. Put family in all caps. And I want to ask you this. If you were to do a family tree right now to ask questions about some health issues in your family, what would be one of the first questions you ask your relative? Okay. Tell me what you would ask your relatives, which relative, and kind of what you're suspicious of. And I'll give you an example of something, Shador, that we've dealt with in our office with one of our very beloved patients. I met him, oh gosh, as a patient when he was 29. He's 40 now. And he's had I won't give all of his business, but I'll just say he has had a kidney transplant, doing well. But when I met him, he's 29 and he was newly diagnosed with kidney disease. And he's like, I don't know where this came from. So then when he started talking to his family, he found out that his brother had passed away. And when he talked to his brother's widow, he found out that his brother had the same kidney disease that I had just diagnosed my patient with. Okay. But had it not been a secret, had he known that his brother had kidney disease all those years before, then very likely we could have slowed down the progression of his kidney disease. And so it's important. It's not about pride, definitely no shame, but share when you have cancer or some type of an illness with family members. And so you can help them to have longer lives, better quality of life. Okay. And so as far as breast cancer, and I have videos right here on this YouTube channel where I talk about breast cancer explained. So make sure you check those things out and check out our live from last week where we went into detail about breast cancer. But again, it's Breast Cancer Awareness Month. 1 in 8 women will be diagnosed with breast cancer. With men, it's less common, but still happens. 1 in 726 men will be diagnosed with breast cancer. And yes, overall, death rates from breast cancer are decreasing. Yay, that's wonderful. But if you are a Black woman listening to the sound of my voice, please don't cross your legs. Please don't relax, because Black women have a higher mortality. We are more likely to die from breast cancer than other women. In fact, Black women are 40% more likely to die from breast cancer than other ethnic groups, okay? Black women are also more likely to be diagnosed at earlier ages with more aggressive cancer, like triple negative cancer that's more difficult to treat. So make sure you consult with your doctor about the proper time to screen, about the proper screening, like the 3D mammogram versus just a 2D mammogram. And make sure you ask your family for this family health tree and see if it's appropriate for you to be tested for certain markers like the BRCA2 that Mr. Matthew Knowles shared that he has. All right. Did anyone share any question they might ask a family member if they were to sit down and do a family health tree?
Yes. Donna Michi.
Hi, Donna. Hi, Donna Michi. Nurse Donna Michi.
Asked, do you remember what diseases your grandmother or grandfather had?
Right. Oh,
So
that's good.
She asked that to her parents or other family members.
That's true, because a lot of us may have had good contact with our grandparents, but perhaps not our great-grandparents. Our great-grandparents may have passed away while we were still young. And so that's a really good question. What diseases? And, and for different ones of us, different cultures, like the Black culture, they may not have had the same access as other people to certain healthcare, but certainly it's amazing how brilliant family members are, parents, grandparents, and they can describe diseases down to a T where you're like, ooh, that might have been lupus, or ooh, that means they might have had blood clots, or ooh, that sounds like cancer. If we just ask them to describe the illnesses or tell us who passed away early. So yeah, that's a really good one, Nurse Donamichi.
Our members already done the homework, Miss Rosalind. She said,
Miss
I
Rosalind,
asked my family, did grandma have cancer? We have to get to the root of it. Who had what? My mother's sister had breast cancer and my father colon.
Very good, very good. And we know, again, colon cancer is quite common, and we have younger and younger people passing away from colon cancer, right? We know that our Black Panther passed away from it, Chadwick Boseman, and it's one of those things where the year for getting screened used to be 50. It was recommended that you get your colonoscopy by age 50. Now it's come down to 45, even if you're a person with average risk. So yeah, it's important. And so I'm glad you were able to find those things out. And I trust and feel confident that you are up to date with your appropriate screenings. Thank you.
And guess who was a little deeper? Who's my mother's biological father? So that's a misinformation. They are missing information from the tree.
That's important too. And that's really something, and now that you bring it up, a lot of times, and Shador, when I'm in the office and I do my histories, I'm like, oh, tell me about your mother. And they'll give me all these details about their mother's mother, mother's sister. Tell me about your father. And, it's not uncommon for patients to say, I don't know anything about my father. And a lot of times if people aren't told about their father, sometimes maybe the mamas just don't know, or maybe there's a sense of shame, or maybe they just don't like that man because he didn't come and help. But for health reasons, and find out, your most comfortable way of doing it, it is important to at least approach and try to find out some family history from your biological father for your own health and for your children and for your children's children. So that's a really good point. Yeah. Good. All right. Well, please go ahead and make sure you give us a like and a follow. And y'all just remember, my one-stop shop is drfrita.com. Anytime you want to come on and just find out general information, be it if you want to book a telehealth concierge service with me, because I love coming here and talking to you as a group, the chat, YouTube, IG, Facebook, replay crew, you name it. But if you want to have a one-on-one consultation with me, I do offer a telehealth concierge service. And of course, clicking the link in the description or going to drfrita.com, you can become a member, where I give you members only videos. Plus, once a month, we have a members only live Q&A where I'm not doing all this talking, if you can believe it. I'm doing listening. And so you ask me questions, and you can press the link and you can come up to the stage and we can talk about your health questions with all of the members. Okay, so take advantage of those things. All right. Who is trying to go on a cruise? Okay, give me a cruise ship emoji if you are planning on going on a cruise anytime soon. Because guess what? A nasty little infection has been taking over cruises. We've had our 19th infection so far with it, and it's with Norovirus, which is the most common cause of foodborne illnesses in the United States. It causes vomiting, diarrhea, headaches. It's no fun. And it's also nicknamed the cruise ship virus. I'm not trying to be a fun snatcher. I'm just telling y'all the truth. So if you're going on a cruise, make sure you're very careful. Let's play this clip and let's talk about Norovirus.
All right. Well, I'm heading this way. TK from IG.
Hi, TK.
It's going on a cruise.
All right, cruising. Listen, enjoy yourself on the cruise. Just make sure that you wash your hands frequently and that you're very aware of what you're eating. Okay, we'll talk, TK. You're gonna have a good cruise.
A norovirus outbreak on board a Royal Caribbean cruise ship has sickened nearly 100 people. The Serenade of the Seas is now docked in Miami. The ship set sail from San Diego in mid-September. This is the 19th norovirus outbreak on a cruise ship this year. That's the highest number of outbreaks in a year since 2007. Norovirus is a highly contagious gastrointestinal virus.
Yep. Y'all know we've talked about it probably last year this time, because norovirus tends to be seasonal, kind of in the cooler months, like maybe November through April. And when you are in places of close contact, like on a cruise ship, or perhaps in a nursing home, or at a daycare, or at a teaching environment at a school where people are in close contact, they can pass norovirus very easily. How? Through, hand to mouth. Okay. If you have a food that is contaminated with norovirus and you eat the food, it doesn't take that many strands of norovirus. It's pretty infectious and it can make you sick. If there's a surface that has norovirus on it, and you kind of go and you eat a little something off of the surface, or you touch the railing on the cruise ship, or if you touch a doorknob, or if you're playing with preschool kids who have it and you pick up that little ball that they've been slobbing on and you put the ball away and you go eat your sandwich and you don't wash your hands, you can get it that way. Okay, so if there's contaminated food or surfaces, also if the person preparing your food has norovirus and they're in there, they run into the restroom, they're coughing and not washing their hands, and they give you your sandwich, you can get norovirus. So it's spread pretty easily. So here's the thing. Once you get norovirus, once you become in contact, it takes 12 to 48 hours generally before you get symptoms. Okay. And the symptoms tend to be nausea, vomiting, diarrhea, headaches. And if you really are not able to keep any food down, you can get severely dehydrated and get extremely ill. The good news is that norovirus is typically self-limited, like it will only last for 1 to 3 days. Something to remember, even after you get over the symptoms, you are still contagious for about 48 hours. So even after you get over the symptoms, please don't go in there and make anybody spaghetti or chicken salad and fry them some eggs or make them a salad or make them some avocado toast. Don't go in there if it's within 48 hours of you having symptoms, and certainly not while you're sick. But you need to see, it's recommended that you see a doctor if you absolutely can't keep anything down. And after more than 48 hours, you're still just very sick, a lot of vomiting, a lot of diarrhea, you might need to go into the hospital and be supported with IV fluids and other supportive care. All right. So for those of y'all who are going on cruises, just make sure you're careful, because here's something that's very important. Hear me and hear me well. I always talk about, keeping your hands clean. I definitely keep hand sanitizer wherever I am, especially this time of year. I can be a little germaphobe. Oh my gosh. But hand sanitizer does not work well for norovirus. Okay. It's a feisty little virus and it can live even with hand sanitizer. And so you want to wash your hands with soap and water. And so going back to that cruise, TK, when you get ready to eat, they probably will have hand sanitizing stations, but make sure you frequently do soap and water, especially if you're about to put food in your mouth. And even after you go through and you touch like some of the utensils that everyone else is touching to get the food from a buffet, after you go through and touch all that, before I put anything directly in my mouth, I would grab some soap and water again. Okay. All right. So that's that on norovirus. And so, yeah, so a lot of people do travel with hand sanitizer, masks. I want you to put in the chat, put TRIP in capital letters, TRIP, and answer this question. When you go on a trip, like a cruise or a vacation or a road trip, what is one health item that you absolutely don't leave the house without? Whether it's your own medications, whether it's hand sanitizer, what is one health item that you absolutely don't leave the house without? All right. Shall we move on to the next thing?
Yeah, let's move it.
All right.
Oh, guess who says Lysol? I was thinking the same thing.
Lysol.
Mm-hmm. Yeah.
Like, and even if you go into a hotel, I know they clean the hotels, but Lysol will kill more than 99% of most bugs. And a lot of people were like shocked because right when we had the pandemic, if you look on the back of the Lysol cans from way back in the day, it already said that they take care of most coronaviruses. That's because the C-19 COVID was not the first coronavirus. Common colds, upper respiratory infections are also caused by different types of coronaviruses. So Lysol can take care of a lot. That's a good one. Ooh, did anybody else put anything?
Gospel Fan says water.
Water. You can get out there and you can mess around and get dehydrated. So having, like if you go to a hotel, especially and you're like in a road trip, having your own case of water or having you a couple of bottles of water, once you, if it's an airplane, once you get on the other side of security, good.
CJ says have to have Tylenol.
That's good. That's good. Having Tylenol or acetaminophen in many cases is the healthiest option for pain control and for fever reduction. So for keeping your Tylenol in your pocket. That's good. Oh, anybody else?
Lawanda says essential oils. She takes her essential oils.
So you mean, so essential oils like maybe lavender oils or things for kind of getting you in a nice zen place, relaxing you, helping you get to sleep, just different essential oils for different ways to be kind of zen and feel your best on trips. Okay.
I remember Ms. Rosalind says HCO, mask, meds, and bleach.
I'm traveling with you, Ms. Rosalind, because you got it all going on. And let me tell you, I definitely think that's a good idea, especially the masks, because just because we don't talk about it as much and it's not in the media, it is COVID season. It is flu season. It is RSV season. And so if you're on an airplane, or if you're in a place that's tight and people are kind of coughing and sneezing, especially if you are at a higher risk, if you're immunocompromised, if you're over the age of 65, and if you just don't want to get sick, okay, if you have chronic disease like kidney disease, lung disease, heart disease, it's a good idea to always keep yourself a little N95 or KN95 just to pop on a little bit, bloop, bloop, bloop. And let me ask y'all this, please. Let's get back to fist bumps and elbow bumps. I was at the National Kidney Foundation, and I was trying to fist bump when I could, but sometimes people just grab my hand. I'm like, ah. That's why I kept my hand sanitizer. Y'all, let's get back to fist bumps. Let's get back to fist bumps so we don't spread infections. Okay, this is a PSA from me, a doctor who doesn't want to get sick, and I don't want to get my patients sick either. All right.
No. One more from IG. Who was it? Sandy says antihistamine.
Oh, antihistamine. So you're talking about things like Benadryl. And so especially if you're someone who has allergies, consult with your doctor, of course. But if you're someone like my son, and it's better now because he's been getting shots for his allergies. Dang it. Is that HIPAA if you're talking about your son?
Somebody, Donna Michi said it is HIPAA.
All right. Sorry, Donna Michi. Okay. Well, I know of some people who are very allergic to the grass, allergic to dog, allergic to pet dander, allergic to the planet Earth. And if you have someone like that, especially, it's very important. Consult with your doctor. And if your doctor agrees, to travel with antihistamines like Benadryl, because if an allergic reaction happens, then even if it gets to the point where you need to call 911 or go to the ER, that Benadryl, oftentimes, or the antihistamine, can calm down the allergic reaction enough to potentially save a life. Okay, y'all, HIPAA's in effect. Don't tell my son. Okay. All right. Let's see. Let's move on to the next thing. Y'all, we're going to talk about RFK Jr. We are, because the Surgeon Generals, okay, the U.S. Surgeons General, 6 of them have come together and they have written an op-ed and they have stated, and I'm not kidding, that RFK Jr. is a danger to the health of America. This is unprecedented. And when I'm talking about the U.S. Surgeons of Generals, the ones who are appointed by presidents and responsible for the health of the nation, these 6 surgeons general, this goes across party lines. Okay. We've got Surgeon General Jerome Adams, who was appointed by Trump, okay, and served. He came out and said that RFK Jr. was a danger. We also have one that was appointed by George W. Bush. He came out and said that RFK Jr. was a danger. And so we're talking about 6 U.S. Surgeons General who've had that very high, very reputable position of being in charge of America's health. They are coming out and saying that RFK Jr. is a danger because of his misinformation on vaccines, on autism, on circumcision. Did y'all hear what RFK Jr. said, that there was a link between circumcision and having autism? I'm not kidding. You can't make this stuff up. Let's play this clip, please.
Surgeons General sounding the alarm on the, quote, unprecedented threat they say HHS Secretary Robert F. Kennedy Jr. poses to public health. For decades, Surgeons General have issued warnings to the public on everything from the effects of cigarettes and alcohol to guidance on mental health. Now these former Surgeons General, who worked under every Democratic and Republican president since George H.W. Bush, including one appointed by President Trump in his first term, are warning Americans about their own health leaders, saying they felt compelled to speak out because they believe Kennedy is endangering the health of the nation.
I am Robert F. Kennedy Jr.
Since becoming secretary earlier this year, Kennedy, a known vaccine skeptic, has sought to swiftly overhaul the nation's vaccine policy. The Surgeons General saying under Kennedy's leadership, science and expertise have taken a back seat to ideology and misinformation, pointing to several actions by Kennedy, like his firing of all 17 members of the nation's top independent vaccine advisory panel. Kennedy then stacking it with people he handpicked. Several of them have been skeptical of vaccines themselves. Just this week, the acting director of the CDC, who Kennedy appointed, signing off on the panel's decision to narrow the scope of eligibility for the COVID-19 vaccine, and changed the recommended vaccine dosing schedule for children, separating the chickenpox vaccine from the shot that protects against measles, mumps, and rubella. Dr. Richard Cremona, one of the surgeons general who penned that warning, pushing back on the changes, saying Americans should trust vaccines.
Get your children vaccinated, and unfortunately disregard what you're hearing from Secretary Kennedy and many of his political appointees who continue to provide mis and disinformation to confuse the public.
The 6 surgeons general also highlighting the controversial announcement by Kennedy and President Trump suggesting acetaminophen use by pregnant women can cause autism, despite no concrete evidence. Writing, rather than combating the rapid spread of health misinformation with facts and clarity, Kennedy is amplifying it, saying the consequences of Kennedy's decision will come and that they are measured in lives lost, disease outbreaks, and an erosion of public trust that will take years to rebuild.
Parents are not sure now, who should I believe? Children don't get vaccinated. They get diseases. They die. They spread disease. Pregnant moms get sick. So when you look at the ramifications, they're catastrophic, all stemming from leaders who didn't understand their responsibility to the American public to bring forth the best science to drive policy.
These former surgeons general ending their op-ed with this: Secretary Kennedy is entitled to his views, but he is not entitled to put people's health at risk.
Absolutely. I'm telling y'all, this is unprecedented. I want y'all to put in the chat, put info, INFO. If you find out that something is going on health-wise, or if you're wondering about an outbreak, or if you're just wondering what to believe, right now, what source do you go to? Okay. I'm really curious, because now that, you know, the U.S. Surgeons General have come out against RFK Jr., you will recall that a great number of the former CDC directors have come out and spoken against RFK Jr.'s information. And so we're not talking about little coincidences. And of course, we're not talking about people staying within their party lines. This is for real. So tell me, put info, who do you go to for health information? And it's really kind of frightening, because we know that for RFK Jr. as the Secretary of Health, head of Health and Human Services, he's responsible for coordination of the CDC, FDA, NIH, CMS. And so that's a lot of power in his hands, which I'm going to say is very frustrating, because he didn't just walk in and get that position on his own. He had to be voted in. And so we have many of the senators, even ones who knew and who expressed that he wasn't the right person for the job. Okay, we talked about the senator of Louisiana, who is a physician, a liver doctor. In fact, he has many sound bites where he's been right there disagreeing with RFK Jr. about vaccines, about the hepatitis B vaccine, about many things, but he still voted to put RFK Jr. there. He's complaining now and begging RFK Jr. to come out and speak, you know, in a pro-vaccine manner to stop some of these outbreaks, like the whooping cough outbreak that's going on in Louisiana. But that senator voted for him. Okay. People have been putting political gain over the health, in public health specifically. So yeah, I'm just curious. Anyone put who they go to for information?
Yeah. Well, guess who on IG says you now, but used to the internet community.
I guess who? Well, thank you. Well, I'll tell you one thing about it. And we know that no one's perfect, but when I come up here and when I give you videos, I already mentioned that right here on YouTube, we have hundreds and hundreds of videos. And I thank you to our over 904,000 subscribers on YouTube. I thank you for trusting me, because I do give evidence-based information. And when I see something that's bold and that is against public health, much like those 6 U.S. Surgeons General, much like those previous CDC directors, I'll come out and I'll speak on it. And after you finish this live, make sure you check out my playlist right here on the YouTube channel. And it's television appearances, where I've been on the Don Lemon show a few times, having to come out against certain things that were said, like Tylenol, autism. I haven't talked about circumcision in autism yet, because RFK Jr. says that there's a link between and he implies a cause-effect benefit between circumcision and autism. I just had to catch my breath, because sometimes he says things and I'm like, huh? Okay, but once I catch my breath, I'll probably come out and say something on that. And I've also been on News Nation. I mentioned I'm going to be talking about more medicine on Fox 5 DC, the local Fox 5 in Washington, DC. Truth Talks Live, and you can watch that here on the YouTube channel at Truth Talks-Live. I've been on talking about I come out and I use evidence. And also, The good thing is that a lot of the major health organizations like American Medical Association, American College of Obstetricians and Gynecologists, American Academy of Pediatrics, thus far, they've been very bold and unified in coming out and speaking against things that RFK Jr. is saying if they're against health. And again, we're not talking about Republicans, Democrats, Independents. We're not divided, between and among party lines. We've been pretty unified. So you still can go to these reputable organizations. And if they start acting up, I'll come here and tell you. Anyone else, say who they go to?
Yeah, a few people did. Power Dynamics. Hello.
Hi, Power Dynamics.
My pharmacist told me to only listen to my doctors and not this administration.
And that's good. If you have a doctor you trust, and even with your doctors, you can ask them, hey, why do you say that? Why do you think I should still get vaccines? And your doctor will be able to tell you on decades and decades and decades of science and study. So that's good. Going to the doctors you trust, the pediatricians you trust, and ask why they believe what they believe. You don't have to just listen to anything in a vacuum.
Limitless Guy. Hello.
Hey, Limitless Guy.
Limitless Guy said, sad to say, but I trust the doctors I see on social media more than the CDC and other similar websites these days.
I know what you mean, because a lot of doctors, and look, and I'm a doctor, I'll pop up on social media, they'll come out and they'll speak, and it is tough because you don't know those doctors, but a lot of times you can go back, look at their credentials, right? And we know that RFK Jr. is not a doctor, he's not an MD, he's not a DO, he's not an RN, he's not a nurse practitioner, he's not a PA, he's not a nurse tech. But a lot of the doctors you'll be able to go through, everything has a little footprint now to see if they really are doctors, if they're really board certified, if they really have the MD they say they have. And a lot of times when they're on social media, and again, you can't trust everything you hear, but you can use your discernment to see if they're giving you evidence that makes sense, if they're telling you even sources, right? Like why they're saying what they say, So just be careful, use your discernment. But I will say that a lot of people on social media actually do know, but don't just listen in a vacuum. Again, pop to those profiles, those bios, see if it's a doctor who's been trusted by national news shows like myself. Being on News Nation, HLN, The Grio, just different things on Good Day Atlanta, the Portia Show. See if it's a physician who's being trusted to go on live TV where they don't know what you're going to say. But if they trust you enough, then a lot of times that can kind of help with your leanings. But yeah, you do have to use a lot of discernment. Good.
Mm-hmm. Francis says your primary care physician and public health department.
Very good. Very good. And that's true. So far, the Georgia Department of Health has been right on as far as the recommendations. Now, for some of these recommendations, when they come from a federal level, that is going to affect the state. But I do find that a lot of times the local departments of health at least will give you proper information on outbreaks. Like when we were talking, what were we talking about? We talked about measles when we had the measles case in Georgia. Y'all, just trust me. Once you finish this live, go scroll through my YouTube, scroll through IG. I give you so much good information, and I often give it in short form content, 1-minute videos, 3-minute videos, where you can get so much information so quickly by listening to my website, to my different platforms. So follow me on the different platforms and give us a like as we move on to our next story. Anyone else?
Yeah, you are a popular answer here, Dr. Frita.
You? Me? Little me? Well, thank y'all. And all jokes aside, I'm telling y'all, I literally read medical journals every single day. That is not an exaggeration. On weekends, everywhere. I'll just pop in, I'll listen, pop in my little, voice to text to voice, however. And so I really do make an effort to stay up on the evidence, to go back, to verify. And so I am honored that a lot of you listen to me when it comes to medicine. And remember, again, no one person is the end all. Cross-check me, okay? Cross-check me, boo, and you'll find that the information I give you is reputable and evidence-based. Who's gonna check me, boo? All right, thank y'all. All right, can we talk about, President Biden, and we've talked about it here, that he was diagnosed with prostate cancer. It was metastatic, stage 4. And now he's undergone radiation. So I just want to give you a little update on President Biden as I remind all of you men folks to stay up to date on your prostate cancer screening.
We've just learned that former President Joe Biden is now receiving radiation therapy for his prostate cancer. Biden's office announcing his diagnosis back in May, noting that it was an aggressive form of prostate cancer, but that it appeared to be hormone sensitive. For more on this and other health-related headlines, we're joined by ABC News medical contributor Dr. Alok Patel. Dr. Patel, it's always great to see you. We appreciate it. So what do we know about this treatment that the former president is receiving, and how common is radiation therapy for this sort of thing?
Well, happy Saturday, Whit. You know, beforehand, we're sending all of our well wishes to Biden and his family on a speedy recovery. So in early stages of prostate cancer, that's before the cancer has truly spread, radiation therapy is relatively common. Now, radiation therapy refers to the practice of using high energy particles literally to kill cancer cells. And this can be done from external beams, which are often image guided. It can be done internally, or it can be done with pharmaceuticals. And I want to add also that according to this report, President Biden is also getting hormone therapy as well, given the fact that his prostate cancer is hormone sensitive. So this is a very common form of treatment, not only with prostate cancer, but with many types of cancers, which is why it's so important for people to be able to have options and have these discussions with their doctors about the available therapies, and also if it makes sense given side effects and the stage of their cancer. And if I may add,
very good. All right. So praying that President Biden does well. Glad that he's still open about what's going on with him, even though he's out of the White House and somewhere sitting and hanging out with Dr. Jill. Will she be around here walking in her heels, and all of his grandkids? But yes, just a reminder, prostate cancer with men, very common. And with Black men, prostate cancer is very, very aggressive. If you are a Black man, you are automatically no longer at average risk. You're at high risk. So consult with your doctor. Talk about when it's appropriate for you to have your first screening, be it with a prostate MRI, prostate ultrasound, a PSA, a physical exam. Have the conversation. Please don't be scared. Don't be scared, because if you're scared because you don't want to be diagnosed, whether you find out that you have a diagnosis or not, if it's there, it's still there. So you may as well face the music. All right. But praying that President Biden does well and that all of you do well. Okay. And an update on someone else, Shador, Dolly Parton.
Yes,
Dolly
please.
Parton. Y'all know we talked about her here, about her kidney stones. Make sure you check that out from a couple of weeks ago, somewhere close to like the September 20th, something like that, the Monday closest to that date. But now let's hear what Dolly Parton has to say, because her sister had everybody scared that she was almost out of here.
Bring your camera over here. I want to say something. Well, today's October the 8th, and obviously I'm here doing some commercials for the Grand Ole Opry, which is why I'm dressed kind of like a country western girl. But before I got started, I wanted to say, I know lately everybody thinks that I am sicker than I am. Do I look sick to you? I'm working hard here. Anyway, I wanted to put everybody's mind at ease, those of you that seem to be real concerned, which I appreciate. And I appreciate your prayers, because I'm a person of faith. I can always use the prayers for anything and everything. But I want you to know that I'm okay. I've got some problems, as I mentioned, back when my husband Carl was very sick. That was for a long time. And then when he passed, I didn't take care of myself. So I let a lot of things go that I should have been taken care of. So anyway, when I got around to it, the doctor said, we need to take care of this. We need to take care of that. Nothing major, but I did have to cancel some things so I could be closer to home, closer to Vanderbilt, you know, where I'm kind of having a few treatments here and there. But I wanted you to know that I'm not dying. Did you see that AI picture of Reba and me? Oh, Lordy. I mean, they had Reba at my deathbed, and we both look like we need to be buried. But and I thought, oh, my Lord. But if I was really dying, I don't think Reba would be the one at my deathbed. She might come visit me earlier. But anyway, there's just a lot of rumors flying around. But I figured if you heard it from me, you'd know that I was okay. So anyhow, that's what I wanted to say.
All right. I just love Dolly Parton and some other things that she went on to say, that she said she had to give her 100,000-mile checkup. And she said she went to the doctor. She said this time, not the plastic surgeon. So she just laughs at herself quite a bit. So just make sure you check out. I put it in short form content on some of my various social media platforms, but also if you check us out from a few weeks ago on our live, you just can run through and you'll see Dolly Parton on our thumbnail from a few weeks back from mid-September, where we went into detail talking about kidney stones, because she did share that she had kidney stones and she had developed an infection related to those kidney stones. All right. Well, please, thank you definitely for everyone. Y'all have been very great as far as participation. Y'all have been giving some real smart answers. Some of the things you say, I'd be like, oh, shoot, I wasn't thinking about that. And so I have y'all come on to the front of the class when y'all come up with things. So I appreciate all the interaction and participation. I also appreciate the giving us a like, giving us a follow. It is a free way to support the channel. It lets YouTube know that we're here. We're here. Get used to it. And after you finish this live, of course, continue to check out my other videos. Please click the link in the description or go to drfrita.com to purchase my book, Under Pressure, A Guide to Controlling High Blood Pressure. Also, make sure you join members. We have our members only live Q&A at the end of every month. And I give you members only videos throughout the month. And if you'd like to have a one-on-one consultation with me, please make sure you click the link in the description or go to drfrita.com to schedule your telehealth concierge service, where I can get your history and give you medical information from all over the world. And make sure you hit your notifications, not only here on YouTube, but also on IG, on all of my social media platforms, because then you'll be among the first to know when I release new medical content, and also when I'm going to be on TV shows like tomorrow. All right, Shador, any kind of comments or anything on the way out the door?
Yeah, I do have a couple of questions I thought were pretty good.
Okay.
Miss Sheree, both of these revolve around blood clots. Does low platelets reduce chances of clots?
Oh, that's a very good question. Having low platelets absolutely reduces your chances of blood clots, because a lot of the blood clots have platelets and fibrin, sticky strings of fibrin, and then other things like red blood cells get stuck in there, cholesterol, different debris. When you have low platelets or thrombocytopenia, you're less likely to get blood clots. But when you have low platelets, you can have a different problem, Ms. Sheree. You can be at an increased risk for bleeding, because we know that your platelets are those tiny little cells that are responsible for clumping together to help clots, because clots aren't all bad. We need clots in order to stop bleeding that shouldn't be. So, for example, if you're shaving your leg and you start bleeding, you'll notice within seconds, the bleeding slows down and you start to see a little clot, eventually a little scab or a scar, where those are platelets going to the scene to help clump together. So we need clots, to stop us from bleeding out. But yes, having low platelets or thrombocytopenia will decrease your risk for clots, but if they're too low, then it can increase your risk for bleeding. If you have in my chart, you can check out your platelets. For most of the lab parameters, between 150 and 350, something like that. 150 to 350,000 platelets in that little blood count is considered normal. If they're lower than that, less than 100, certainly if they're extreme, less than 20, then you're at risk for bleeding if you have a fall, hit your head. But yes, having low platelets will decrease your risk for having blood clots. Good question.
All right, thank you. And then Gloria.
Hi, Miss Gloria.
Gloria says, I know someone in a nursing home. She requests but is not receiving physical therapy. She's not able to walk, but I believe the home can give PT in the bed to prevent blood clots. Is that right?
That is correct. That is correct. So I want her to continue to request, and I want her to have an advocate. And it always helps to document. If she is able to document or to email, if not, if she has a family member, or if even someone who works there, or if you can help her to facilitate actually emailing the appropriate head at the facility requesting physical therapy, they can come and work with her arms, work with her legs, help to move her around, even have occupational therapy. And of course, it's going to depend on her level of function and ability, her level of debility, since she's unable to walk. But yes, there is something that they can offer her, even if she is not able to walk. And certainly I would ask, I would make sure that she knows what they're doing to help to prevent her from having blood clots, because if she's not walking and if she's pretty immobile, as we mentioned, being sedentary increases your risk for blood clots. So we want to see if she has compression stockings, if she has some of those sequential compression devices, if she's getting heparin shots, Lovenox, just make sure that she's getting some type of DVT prophylaxis or blood clot prophylaxis prevention. Very good. But yeah, they could do something for her, even if she can't walk. They're being sorry.
All right, and shout out to Princess, Dr. Frita, someone we may or may not know. She said, "Thank you for saving my kidney."
Oh, I'm so happy. Oh, I really pray that your kidneys continue to do well and that your overall health as well. Thank you, and thank you for supporting.
All right, and I close with our member, Ms. Rosalind. Thank you so much. So glad I have met you. Love you both.
Oh, we love you right back. That's a nice feel-good moment. All right. Thank you. Thank you. And thank you to all of y'all for supporting us. We'll be here next Monday, same bat time, same bat place at noon Eastern Standard Time. Again, follow me on all social media platforms. Hit that like on the way out the door. I give you different information on different platforms. And look, check me out this Wednesday for Medical Mornings. Go ahead, follow me. You'll see where I am. All right. Thank you. And as always, thank you to my co-host and office manager, Miss Shador. Appreciate you.
You're welcome.